adolescent psychiatrist, who are also both co-directors of the Kids of NYU Foundation Integrated Behavioral Health Program, part of the Sala Institute for Child and Family Centered Care at Hassenfeld Children's Hospital, NYU Langone. So thank you guys for joining.
Thanks for having us.
Absolutely, thank you.
So most children around the country are back in classrooms by now, but this school year isn't quite the return to normalcy that everyone had hoped for. So there are already feelings of uncertainty and anxiety for many students. So today we're going to offer some tips that parents, teachers, and all adults can use to help our children with back to school stress and anxiety and navigate all the unknowns. So for the audience, if you have any questions for Dr. Lois or Dr. Ort, please leave a comment and we'll address it during the live. So I want to start with a question for both of you. So with classrooms and school closings already kind of happening, what can parents do to mentally prepare kids for yet another potentially challenging year? Dr. Lois, I'll start with you.
Sure. So, I mean, I will say over the past year and a half plus, I've been really impressed with the resiliency of our kids. And I think it's important for parents to remember that our kids are more capable of handling situations than we anticipate and often really benefit from some preparedness and conversation and ability to understand what to potentially expect, what they can control, and perhaps things that might come their way that could be unpredictable or out of their control. So I think that recognizing that it is an unpredictable course that we're kind of in, and that's okay, and helping kids think about aspects of their day or their week or their routine that they have control over, and really kind of reinforcing and focusing on those pieces of the picture, but acknowledging to your kids, you got this, we've done this before, we're going to continue to do this, and it's okay. If things maybe don't feel the same, we're going to continue to plug away and figure out how to make it as comfortable as possible.
Dr. Ort, do you have anything to add to that?
I totally agree. I think if there are opportunities for things that can be consistent, that you can control, naming that and giving kids opportunities to have some routine and sameness in their days and things that they can count on. And then to be flexible and recognize that things are going to change. I think it's not if, it's when, in terms of expecting things to be different and for that different to change over time. And so to be flexible yourselves as parents and caregivers, and recognize that there may not be, we can't control everything, but for those that we can, give kids those things to count on.
And both of you guys touched on the importance of routines. Why is that important for our children? Dr. Lois, if you want to start on that.
Sure. So kids thrive in structure and predictability. It helps them feel safe and like somebody sort of looking out for them, and they kind of know what's coming next. Where I think we see uptick in anxiety and worry is when they can't kind of understand what they're supposed to do or what might happen if things are different or changing, or who should I go to, right? It kind of creates a sense of destabilization for kids. So I think particularly in times of stress or uncertainty, it can be incredibly helpful to have that predictable structure, routine, understanding for kids to know where they're supposed to be, what's going to happen when I'm there, who's available to me if I have a problem or I need to ask for help, and really, again, sort of reinforcing and discussing that as a family can just help calm a child in the midst of the kind of chaos that we're all dealing with right now.
And Dr. Ort, is there any common concerns you're seeing in children that they seem to have about going back to school? I know there's been some concerns of social anxiety or separation anxiety from parents. Is there anything you can share?
Yeah, I think absolutely. I think a lot of kids are feeling the same things that we as adults are feeling as we transition back to different versions of normal. And for a lot of kids, particularly who had social anxiety even before the school closures, remote learning, the pandemic provided somewhat of a relief from that. And this transition going back in can be very anxiety provoking for kids, and kids who, never experienced social anxiety before are going from these two extremes can be very jarring. And I think in those cases, it's really important just to validate those feelings, recognizing and telling kids that other kids feel this way, actually even adults feel this way, and it's really normal, and that it might feel funny at first, but also to allow room for positives and excitement. I think sometimes we can kind of project as adults that we might be nervous about some specific things, and that might actually not at all be what the kids are nervous about. So being open that this may be a common feeling that are coming up for other kids, but allowing the space for them to bring up a different concern that you might not have even expected.
And what are some signs that parents might see the children feeling anxious or otherwise struggling emotionally? What can they look for?
So, I mean, I think parents know their kids incredibly well, right? And so I think any general change in your child's behavior or demeanor, if they're typically a really sort of bubbly, happy child, and all of a sudden they seem more quiet or withdrawn or spending more time in their room with the door closed than perhaps you're used to, could be a sign that there might be some increase in distress or concern. Kids who have a lot of worries may either, again, kind of pull into themselves and be very sort of separate from, and we also see kids who become really activated and may ask a lot of questions, look for a lot of reassurance, like, am I okay kind of language. I also think we see kids who are distressed having changes in their sleep, changes in their appetite in any direction, right? More sleep, less sleep, more of an appetite, less of an appetite, right? So noticing those kinds of things, abilities for kids to focus and pay attention and sort of sit and listen in a way that they're normally used to being able to do. And so I think these kinds of behavioral changes, right, that parents may pick up on or that kids start to share or report about could be indications that there might be some increase in distress, whether that's worry or sadness or something else, right, may require additional conversation or potentially intervention from somebody at school or in the community. But just those, I think, kind of basic things for parents to look out for.
Yeah, I would totally agree with all of that. The one thing I might add for younger kids is they may not say that they're nervous or worried and or even have some of those other signs, but some anxiety or mood changes may manifest as physical complaints like stomach aches or headaches or feeling tired or sleepy, and being aware of that. If your kid's not someone who usually complains about those things and those things are coming up, it may be a sign that they're struggling with something, that they're having a hard time articulating the words to use to express that.
So how can we talk to our children about their concerns of being in school or possibly contracting COVID-19? What would be some best practices that you'd share with parents and maybe like something to help validate those child's feelings? Dr. Ort, I'll start with you.
Sure. So I think as we've been talking about, I think just being open to whatever experience your kid is having and be open to receiving that as a valid response, given that none of these situations are situations any of us have ever been in before, and we're all going to have really different reactions and responses. And I think the way that you can validate whatever their experience is to really normalize it, that everybody's having a different response, and that all of those things are okay to feel, and to let them know that you're always here if they want to talk about it. And I think giving them the space that you may ask about it and they may not open up right then. And that's okay. You don't need to push it and force it that first time. Even asking, they've heard that you've asked and that you're open to hear about it. And you can revisit it later on, but creating that space where kids know that they can go and that there's a safe person to talk to, I think goes a long way.
I guess another question is like, what can parents do to help children like make new friends, given there is that social anxiety aspect that we've all kind of been feeling since going back into the real world? What can we do to kind of help children make new friends, and what should they not do? Dr. Lois, do you have any thoughts on that?
Sure. Yeah. I mean, I think the social aspects of this have probably been the most challenging for kids. And we know that when they're lacking in the ability to socially connect and relate, right, that kids are going to probably have a reaction and sort of a negative response in their ability to cope, right, if they don't have access to same age peers and aren't able to play and have fun and enjoy that part of their life. So of course, I think it's really important. And one of the wonderful things about the school year sort of restarting, even though I recognize for folks what it looks like may not be ideal, that there's at least that opportunity to interact again with peers, even if perhaps it doesn't feel sort of normal in the way that, you know, life felt pre-COVID. I do think that, you know, recognizing that our kids may have lost some skill around how to make friends and how to talk to kids and how to navigate a mask and the distance and right, all these realities is real. And I think important to be able to talk about that. It might feel funny or you might not know what to say, and can we maybe practice, you know, depending on the age of your child. I can imagine that teenagers may not be keen to practice social skills with their parents, but perhaps, you know, a younger child to sort of pretend a bit with daddy or mommy or, you know, grandma, grandpa, whoever, you know, what I might do if somebody came over to me and said hi, right, and vice versa. And I think too, you know, there are creative ways to be socially connected, and a lot of our kids that we work with will continue to use online forums to engage and make friends, right? Recognizing that, you know, sometimes parents are concerned about what happens in those forums, and like that is absolutely an avenue where many, many kids continue to socialize and engage and meet new people. So I think thinking about how to help proactively, you know, help your child continue to do that in a safe way that you as a family feel comfortable is good. And I think, you know, while the weather is still okay, play dates, you know, at the park and, you know, opportunities to get together outside, especially if a kid is nervous about social engagement, it could be one-on-one with a friend that they're very close with, right? To get them an opportunity to sort of practice in a smaller setting than the classroom, I think can also be a helpful thing to consider.
I think that's very important and helpful for parents. We did have a audience member write in a question for you guys. They are asking, my kindergartner comes home each day grumpy and miserable and reminds me of how he was at the age of 2, 3 with crying and tantrums. I thought he was just tired, but is this a sign of being mentally overwhelmed? How can I help?
Yeah, thanks for asking the question. And I think we're definitely seeing this. And I think that that's a very normal response to this incredible, overwhelming change in routine. And that this takes time to adjust to. I think one of the things we'll definitely see is when kids go back into the classroom where there is much more structure, there's much more social engagement than they're used to, there's much more stimulation, and kids may do a good job of kind of keeping it together with a lot of effort during the day. And then when they get home to their safe space with their safe caregiver, they have the permission to melt down then. And I think that adjustment to the routine takes a lot of time, because this takes significantly more effort for them in a much more stimulating environment. And that sort of seemingly regression in behavior and the melting down, I think can be expected in this transition back. And I think is a sign of the effort it takes to really be in that environment, and then that they feel safe enough at home that they can have that opportunity to let go a little bit.
Thank you. No, that is definitely very helpful. I also wanted to ask, parents also can feel anxiety about this transition. So what are some healthy coping strategies that they can use to make sure they're managing their own stress instead of expressing it in ways that may increase a child's distress? Dr. Lois?
Yeah, I mean, listen, agree. I think that's so important. And, you know, I think, as I said, when we first started talking, that kids are really resilient. And I think sometimes we as parents may may have projected, I think Katie used that word, which I think is really appropriate, our own worries and concerns onto our kids inadvertently, right? And kind of making an assumption that our kids are thinking about the situation in the same way that we are. And it's really important to be able to identify and have some awareness over your worries, your thoughts, your feelings, and how you can sort of decouple them as best as you can from how you're going to approach your child. And that's not to say that it's not okay to acknowledge to your child that this is hard for everybody, including you as a parent, right? I think that's really appropriate modeling for your child to be able to acknowledge that, this is really hard and I'm struggling too. And I worry and, I feel sad sometimes, about all the things that are different, right? And that gives our kids permission to feel what they're feeling and know that it is normal and it's okay to talk about it together as a family, right? But I think in terms of navigating your own emotions as a parent, recognizing that your fuse may be shorter with your child, you may, find yourself incredibly stressed and navigating or anticipating a lot of concerns about the start of the school year and your work and your home life. And, people have many different ways, right, in which they manage that level of stress. But I think making sure that that's a priority, whether it's to take a few deep breaths upon entry to your home at the end of your day, or upon leaving your home office to step in with your children, or picking your child up from school, right? How can you give yourself a bit of a transition moment between that, work or parent life and engagement with your child? I think is really, that's like little stuff, right? Those like few breaths, kind of grounding yourself in the moment, recognizing what you're capable of managing and what maybe is too much for today. And then other things that are really good, like think about like putting them in your like emotion bank, right? How do you kind of balance yourself out and make sure you've got some reserve to navigate? So exercise, eating well, getting some sleep, having your own outlet and source of support to talk through this, whether it's your spouse or loved one or another parent that who's going through similar things, or a therapist, or whatever's helpful, to make sure that you have space to talk about this, because I think it's incredibly challenging for everyone, and parents are not immune, right, to their own emotional experience of this as they're about to kind of encounter as parents, right, these issues in their children.
So we had actually another parent write in. They said, as a family, we've been very careful and cautious about COVID and haven't socialized much. Now my child is in school and a big group of kids, and this is triggering his anxiety. How can I help him feel safe? Is he too young, he is too young to be vaccinated?
Yeah, so I think this is another one, a really common worry with this transition. We've gotten used to the isolation piece, and then now how do you transition to more interaction? And I think that the biggest thing is to validate the kids' experience of that it's normal to be worried, and not reassure them with things that you can't reassure them for. Like, we cannot promise that they won't get sick, but we can promise that we're doing everything we can to keep them safe, and being able to name to your kid all the ways in which that you're keeping them safe, whether or not it's with the masks or social distancing or monitoring for symptoms, and knowing that schools and your family have their own protocol that they'll take if anything happens. And I would also ask exactly what they're worried about, and say that, it's normal to feel worried. Tell me a little bit more about what specifically you're worried about. Because as we've talked about before, you may be surprised by what specifically it is that they're most worried about. And if their question or their worry is something that you don't know the answer to, that's okay too. You can reassure them with what you do know, and let them know that you'll work to find out about the other stuff if it is something that you can find out about. And if it's something that no one can know, because there's a lot that's unknown about the future, you can still focus on all the things that we do know and what we can do to keep ourselves safe, both at school and as a family.
And I guess that leads into this with kids maybe finding themselves in crowded hallways and traveling on a subway to school. And this does have potential to fuel that COVID anxiety. What can you say or do to help your child feel protected in those environments?
So, I mean, I think this comes back to, again, like what's in your control, right? And what do we know about keeping ourselves safe? And what have we learned, right, as a result of the past, year plus through this experience of COVID, and making sure that your child feels in control of that and comfortable, right? Exercising what they need to do to keep themselves safe, I think is really important. It's an inevitability, right? For those of us who live, in the city and the urban areas, right? That you're going to be confronted with people in relatively close proximity more and more. And something that we know about anxiety that can both make it, relatively straightforward to treat is that what helps anxiety a lot is exposure, right? Is doing the things that we're most afraid of doing and seeing that when we do them, it's okay, right? And to Katie's point, we can't guarantee that it's okay with COVID, which is why it's so challenging, right? When people have these worries, and yet people can mitigate, right? People can do things to protect themselves, to keep themselves safe, to remind themselves that they are doing those things. And that's really the best that we can do, right? Because the alternative is to not go to school or to not leave your house. And we know for everyone, but children especially, that is incredibly detrimental to their emotional health and well-being, right? So we need to help our kids and ourselves get out, right, safely and in a way that we're comfortable. So I think it's that edge, right, of recognizing that the fear and the worry is there and that we have to normalize that and we can't make promises, while also highlighting the alternative, which is not appealing, right? To not be able to do anything or go anywhere, right? Like that's the only way to stay safe, potentially, I guess, right? And yet, what does that mean in terms of the life that your child would have and that you would have as a family? So I think, again, those decisions are different for every family, especially when there are kids or family members with medical conditions or comorbidities that there's concern. But I think that piece is important to contend with, that you're never going to feel, even pre-COVID, right, 100% sure that everything is okay. And how do you live with that, right? Still live your life with that.
Yeah, I think that's a great point, and would just add, I think that everyone's comfort and routines that they've decided are different for every family. And I think preparing kids for that and saying, in our family, this is what we do as a family to keep ourselves safe. And other kids in other families may have different situations, and that means that they're doing different things to keep themselves safe. And that's okay too, but this is what we do for our family. And just naming that difference, because going back to school, they're going to be exposed to people who did different things in the past and maybe doing different things in the future, and letting kids know that that's okay, and reminding them of what the things are in their family that they do to keep themselves safe.
Great. So we do have another question from our audience. My teenager really resents losing a year of high school to COVID-19. She is very angry and feels robbed, and is now resisting any discipline or curfews and doesn't want to do schoolwork. How can I help her refocus on academics when to her it seems pointless compared to wanting to have fun?
Yeah, I mean, it's such an important question, and I feel for kids in this age group through this. I think it's been incredibly hard for kids that are looking to explore and gain some independence and really establish their identity and who they are as a person, and to have had so much kind of taken away at that formative time of life, I think is incredibly upsetting. And it sounds to me like your child is dealing with that anger, right? With that feeling of sadness and loss. And it's sort of looking, right, on the outward side as defiance, right, as sort of rule breaking. And so I know we've harped a lot in this time about validation and conversation, communication with kids. I think in this instance, I don't know if this has happened yet for you and your child, but to be able to have a conversation about those feelings, right, and really open the door to talking about the loss and framing it as that, right? Being able to allow for her anger and her sadness and her grief, right? I mean, it's a loss of a year of her life at a time that was so critical. And I think the more that you can elaborate on that and help her hear that you're listening to that and trying to understand that experience for her, the less it becomes a battle about what she's dealing with and what you're dealing with, the less apart you are as people in the house. And I think once you've had that level of understanding with her, there tends to be some openness to explore the possibility of your concerns and your challenges as her parent, right? To be able to say, I totally hear you. I completely understand that this has been awful, right? And I'm so sorry that this has been the experience. And my struggle as your parent is that I have to help you continue to follow the rules of the house and keep yourself safe and get through school. And I want to be able to work together on how you can continue to be social and have this part of your life come back online as much as that's feasible, and continue to do these things that we need you to be able to do under the umbrella of our house, right? And so then it becomes a conversation that could be perhaps a bit more collaborative with her once she feels heard and understood on the emotional side. I'm not saying that she'll necessarily jump right on board with curfew and homework and all of that, but I do think it can go quite a way to be able to spend some time listening and understanding her experience in a pretty heavy duty way, like maybe 20 minutes of that, right? Like a really substantial chunk of time, and then seeing what she's willing to talk through and problem solve with you so that everybody's concerns are met in the house.
And I guess a little bit of a pivot, but another audience question is, I want to encourage my 16-year-old to get the COVID vaccine, but he's really hesitant. What can I say to him to ease his anxiety and assure him?
So I think now we're starting to get a lot more information, much more so than we had before. So I think there's certainly a lot more evidence and reassurance that's able to be provided. But I would really start with what his concerns are specifically about the vaccine and what is it that he's hesitant about, because you can kind of rattle off all the new statistics that are coming out. You know, every day there's new information. Every week, you know, there's a new release and updates on the studies. But I would try to explore specifically what is it that he's worried about. And there's lots of sort of different things that kids may be worried about. Some kids just really don't like needles and getting a shot. And, you know, are there things that you can do to prepare for that experience to make that easier? Or, you know, are there concerns about, you know, socially, you know, what this means and what people's friends are doing can really influence how kids are thinking about what they want to do in terms of making decisions for themselves. Other kids just like the idea that they finally get to make a decision and that they have an opportunity to say no to something that feels like one thing they've got control over in a situation that feels completely out of control for so many kids. And so I would try to unpack a little bit exactly where your child is coming from to try to understand. And then that gives you a little bit of a better opportunity to then work to figure out what, if there is more sort of research information that might be helpful or some problem solving that you might be able to do together to move them in that direction.
Great. So as we're wrapping up, I guess a question that I want to ask you both is, where can parents turn to? What resources can they use to help their child is struggling emotionally?
It's a great question. And I think, you know, through this stretch of COVID, there's been so much, right? Increasing kids in increasing numbers being more and more distressed and in need of support and help. I think one of the easy sort of first line avenues for families to consider is their primary care physician, because primary care physicians are fantastic and really well trained in screening and assessing for emotional health and well-being in kids, and can certainly provide advice and usually have resources and referrals for families to consider. For folks in the New York City and surrounding areas, there's a resource called NYC Well, which is an opportunity. There's a website. There's also like a hotline number that folks can call to gather referral resources, different types of resources for mental health and wellness, not only for children, but for adults, whether that's through your insurance or not. So there's a lot of really great resources there. But I do think that thinking about school and your primary care physician as those touch points of, people already engaged with your family who know your child, who have these types of resources at their disposal, they can also help with an added set of eyes, right? To meet with your child, to take a look, to observe in the classroom, because sometimes parents have a concern and they are looking for someone else to tell them if the concern is valid, right? And those are people that are already a part of your system and network. So I think those are good first places to start.
And is there any kind of final thoughts that you guys have that we didn't touch on during this time?
I would just add that, and I think we did touch on this, just that this is really hard, and this is hard for everybody. It's hard for kids, but it's hard also for parents and caregivers of kids, and you're going through your own transition while you're trying to help your child go through this transition. And so in the same way, we want to be able to validate for our kids. We should be validating ourselves that there's going to be a lot of times where things aren't going to go perfectly, and we need to be flexible both with the routine and also gentle with ourselves as we navigate this. Same goes for the teachers who are also figuring this out in school, and doctors and everyone working in the community. And I think just recognizing we're all trying to figure this out, and it's going to take some time, and we'll be constantly evolving. And so to just be gentle with our kids and gentle with ourselves through that process.
Great. Well, thank you everyone for watching, and thank you Dr. Ort and Dr. Lois. We hope we've provided some helpful information about managing your child's anxiety during this school year. So please visit our website at nylangone.org to learn more and find resources to help your child emotionally and mentally. And thank you for joining. And please click the like button on the Hassenfeld Children's Hospital page to learn more about future Facebook Lives. Thank you.
Thanks for having us.
Thank you.